Hey, and I hope this finds you well. Welcome again to the Farmers of Health channel. Remember, here we are farming thoughts, we are farming researches, we are farming ideas, we are farming good eating habits, we are farming issues that are health related, that when we apply in our lives, then we are assured of quality health. Today at the Farmers of Health, I'm bringing for us something to do with the vision. You'll agree with me that there is nothing so much important to us like vision. Your eye is like the visa through which you can see the other side of the world. And it's one organ whose loss can really lead to a lot of depression. So I want to talk to us about vision loss, which is acute and is painless. Most of the time, we tend to ignore when we have vision loss of whichever degree, either in both of the eyes or in just one eye. Most of the time, we can walk to the pharmacy and take over-the-counter drugs, and the drug that we've abused the most is called Probeta N, which again is not a drug that is good for the eye. Most of the time, also I find people go for prayers, some using herbal medications and concoctions. So what is it that we should do whenever we have any degree of visual loss? And what are the causes of painless visual loss? So this is your normal eye, and I'm looking at the back of the eye. And the area that you are seeing blood vessels coming out nicely from the center, that is called the optic nerve, the area that looks like yellow. And those are blood vessels that are coming out of the optic nerve into the retina just to supply the rest of the eye with blood and nourishment. Again, at the optic nerve, that yellow part, you can see that is now where millions of ganglions of cells leave the eye as they go to the brain. So usually this is where everything that we see is being relayed to the brain for interpretation, so that the brain can tell us what is it that we are seeing. Okay, you can see but you cannot perceive. So you should see and perceive at the same time. You see and you are able to interpret that whatever I'm seeing is a human being or a car. Now, on the lower side here, the area that is a bit darkened, this is the macula. And this is the area that we get the most clear and detailed vision. Okay? Now, there are conditions that will give us an acute reduction in vision or loss of vision. And most of the time, you'll find that we run again to the optical outlets to get glasses that will serve us maybe for a short period of time, maybe 1 week, 2 weeks. Then again, we go and change maybe after 2 months. So again, it's usually not normal when you are having frequent change of your glasses. You need to get your eyes checked by an eye specialist. Most of the time we delay until late to the facility, or we come very late to us when there's very little that can be done to restore your vision. So what is acute painless vision loss? It means there is a reduction in vision, either in one eye or in both, and it is not accompanied by any eye pain, right? So what are the things that can give us this? So whenever you experience sudden, it can be immediate, it can be 2 days, 1 week, 2 weeks, a month, please ensure you consult an eye specialist so that you can be checked and the cause is eliminated. Of course, there are several factors that play in this, and varying from vascular causes or vascular problems or vascular abnormalities to retinal causes and optic nerve causes. So for acute, when I talk of acute, it's of a short duration. Painless, it means there's no associated eye pain. And loss of vision, it means there's a loss of vision to a certain degree, or complete, or partial. Now, one cause is called amaurosis fugax. Now, with this, there's a temporary loss of vision in one eye, and often it's described as a curtain or a shade coming down over the eye. So the patient will tell you, I'm just seeing darkness that is covering my eye from down over the eye until now it completely blocks the vision. Now, this will lead to a painless acute loss of vision caused by blockage in the carotid artery. Another cause is called atteritic ischemic optic neuropathy. So here you can see the blood vessels that are supplying the optic nerve running up and down. You can see in that diagram. So you find that there is an inflammation of these arteries such that the blood supply to the optic nerve is cut off. So this again will give you a sudden vision loss. Again, we have non-atteritic ischemic optic neuropathy. Now, in this, there is a blockage in the blood vessels that are supplying the optic nerve. And this is now how the optic nerve will look like. You can compare this with the one I showed you initially. These are completely different structure from the one I showed you, where the disc margins are becoming blurry, right? Now we have again another one called retinal detachment. Now in retinal detachment, it means that the separation of the retina, that is the neurosensory part, from the retinal pigmented epithelium. So this separation can be caused by so many issues. Number one is you have a bleeding there, or you have some fluid accumulating below the retina, okay, or there is some pulling, okay, there's some pulling of the retina from its original, or from its position, what is called tractional retinal detachment, okay, breakages within the retina, and it's pulling it up or off now, okay. Now there are systemic conditions and systemic lifestyle diseases that of course will give you this picture: hypertension, diabetes mellitus, toxoplasmosis, HIV/AIDS, sickle cell disease, among others. So make it a habit of always visiting an eye specialist to check the condition of your retina, right? So this is how a detached retina will look like, even in an OCT, which is a CT scan for the eye. Another cause of sudden vision loss is retinal vein occlusion. Here, the vein that drains blood from the retina becomes blocked, leading to the sudden loss of vision. You can see from that in that diagram. Another thing that will give us sudden loss of vision is called vitreous hemorrhage. Vitreous is a jelly-like fluid that is found within the eyeball, and it is there to give our eyes shape, and it's also there for optical functions. It helps us to see, right? So there are conditions that will make us bleed. Okay, and of course I've mentioned diabetes, I've mentioned hypertension, sickle cell, right? Among others, including trauma, right? Now, once there is that bleeding or leakage, then it will fill the center of the eye, and then you'll not be able to see, okay? Then another condition that will make us have sudden loss of vision, which is painless, is central serous retinopathy. And you can see from this image, this is an OCT of the eye, and you can see there is a fluid-filled area around the macula, the area that is darkened, right? That is fluid. and it can even end up giving us again a detachment of the retina from its original position. Another one is cystoid macular edema, accumulation of fluids within the macula, causing sudden vision loss. Again, very common in diabetic patients and patients with hypertension. Get a chance at least to go to an eye specialist when you're diabetic, when you're hypertensive, to check your fundus. Remember to avoid these inflammatory foods. I've always told you to avoid seed oils that are very toxic and highly inflammatory. Avoid fruits, okay, and fruit juices, including honey, that are very toxic to your body. And number one cause of eye rot is actually sugar, right? And always avoid the highly refined carbohydrates. If you can, avoid at all costs. Highly refined carbohydrates are things that will interfere with your sugar levels, and in turn sugars will mess up your eyesight and your eyes. Concentrate on foods that will nourish the eye, foods that are rich in vitamin A, vitamin B, okay? These are organ meats, the liver, okay? These are fatty meats, the saturated fats, which will help you really absorb a lot of vitamin A that in turn will nourish your eyes. Again, if you are having any systemic infection or any systemic diseases or lifestyle disorders, make it an habit to always visit an eye specialist to check the back of your eye, to check your optic nerve. If you have a sudden loss of vision, please let not glasses be your number one choice. Ensure you see an eye specialist to check at the back of your eye. Now, as I conclude, this is another cause for sudden loss of vision. It's called optic neuritis. Now, optic neuritis is a condition where the optic nerve becomes inflamed. Okay? So when it becomes inflamed, you lose vision. Like you see the image I'm showing you, this is a patient who had sudden loss of vision in one eye, went for glasses. After 2 weeks, vision never improved. It got worse, right? And when the patient came for review, I found out that he had what is called optic neuritis. In fact, this is now neuroretinitis because the optic nerve is swollen. There's edema at the optic nerve, and again the macula, you can see the macula also has got a lot of exudates, a lot of lipids that at the macula, right? So, and also marked with there's also marked vision loss. So this is called neuroretinitis. Otherwise, we have other condition of the optic nerve like papilloedema, infections of the brain, or meningitis. But sometimes you don't even have these conditions, but yet you present with papilloedema, meaning there's something that is really affecting your optic nerve that is now making it to swell or to have edema. Okay? And again, we also have papillitis. Papillitis, you can see from the diagram again, you have blurry disc margins, right? There's a disc hemorrhage, dilated blood vessels. Okay? Most of these conditions will actually not present with eye pain, but the only symptom you'll be seeing is vision loss or reduction in vision. Maybe in retinal detachment, you can have issues to do with photopsia. Photopsia is when you have light stimulation in the absence of light. Oh, that is, patient will tell you, like, even when I close my eyes, I see flashes of light moving. Okay, and sometimes they can have floaters. Floaters are these things moving, like they are cobwebs. When you move your eyes, they're also moving when you move your eyes like this, and they are strings. They look like cobwebs. When you try to touch them, they are not there. They are actually not in the universe or in the environment. They are inside your eyes at the vitreous. So they are the things that are casting shadow to your retina, and you're now able to see them as objects that are moving. They're called vitreous floaters. So when you're having vitreous floaters, when you're having photopsia, that is stimulation of light in the absence of light, urgently see an eye specialist for evaluation. We shall be discussing the conditions I've mentioned into more finer details. Thanks for listening. Keep it here for your health and eye-related problems.